Yeah, this is actually based on the phase 3 IMerge study, a study which evaluated Imetelstat as a monotherapy compared to placebo in patients with highly transfusion-dependent lower-risk MDS who were actually relapsed refractory to erythropoiesis-stimulating agents. As a matter of fact, the entire Imetelstat program also included a phase 2 part and also an extension study to monitor cardiac toxicity. So there is actually plenty more data available with regards to the efficacy of the drug in patients with various prior therapies. And this includes not only EPO, ESA, but also Luspatercept, Lenalidomide in non-del(5q) disease, and also a couple of patients received HMA-based therapy. And the intention of the analysis was therefore to look at the response rates of patients depending on the type of prior therapy. And to make a long story short, the drug actually was still very efficacious in patients not only receiving ESA-based therapy before, but also in patients receiving prior Luspatercept and also Lenalidomide-based therapy. The response rates were a little bit less in patients receiving prior HMA-based therapy, but again, numbers were in general also small, so only a small subset of patients received prior therapy outside an ESA before the study entry. So to make a long story short, I think Imetelstat is already approved in the US by FDA as a second-line therapy. And of course, now we have plenty of other opportunities. Also, Luspatercept is an approved first-line therapy. Therefore, we can state based on this analysis that Imetelstat not only works in patients failing ESA, but also works in patients failing prior Luspatercept and or Lenalidomide-based therapy.